And sometimes people can present with back pain. Remember that the kidneys are at the back. So if you have a urinary tract infection that has left the bladder and has gone up to the kidneys, people will come in with severe pain in the back, and that's what we call a complicated urinary tract infection.
Hello, our online viewers of Pediatrics to Go family. So today, let's talk UTI, that is urinary tract infection, with your trusted pediatrician, one and only Dr. Ekuase Sanusi.
Thank you, Francisca. UTIs are more common generally in women than in men. And the obvious reason is the anatomy of the female genital area. It's commoner in children when they are in diapers. So it's also common in girls when they're potty training, because little children that are 3 years old that have been in diapers, next week they're supposed to go to school. A lot of schools insist, oh, they have to be potty trained before they can start. So you start taking them to the potty. At first, they're being cleaned. And then next minute, all of a sudden, they're supposed to figure out how to clean themselves when they use the potty. And most of those children can't. So they end up cleaning the wrong way. Little girls will clean poop. They'll clean from back to front. So basically, they'll put poop in the pee area. And that increases the risk for urinary tract infections. And we see quite a lot, especially in 2 and 3 year olds that have just recently potty trained. So it's common in the newborn period also, when children have high fever and there's no cold or runny nose, but they're just fussy and extremely uncomfortable, and they're holding their urine and they don't want to pee. So we usually have to do a cath urine. So anytime we're looking for a source of infection in a child less than 2 years old with a high fever, we usually do a urine test to make sure that we're not missing any UTIs. Now, for older children and teenagers, urinary tract infections are still commoner in girls. And especially if a teenager is sexually active, they could have a urinary tract infection. And there's lower urinary tract infections, which is the bladder, which is way down here. And sometimes people can present with back pain. Remember that the kidneys are at the back.
Okay.
So if you have a urinary tract infection that has left the bladder and has gone up to the kidneys, people will come in with severe pain in the back. And that's what we call a complicated urinary tract infection. When there's a urinary tract infection that's simple, it's called a cystitis, which is inflammation of the bladder. But if it's the kidneys, they're talking pyelonephritis, which is upper urinary tract infection. And the children or teenagers will have back pain. They could have fever, and they could just be extremely uncomfortable and just extremely fussy. Now, when we do the urine analysis, we have children give us a clean catch. Basically, they clean themselves and then they pee into a cup. And we do urinalysis, which is done right there in the office. And then we send a culture for the urine to see if it grows anything. I tell parents, growing a culture is like putting urine in a flower, or like putting seeds in a flower bed to see what grows. Majority of the time, especially in a normal child, E. coli will grow. E. coli is in the stool, and it likes to migrate into the bladder and cause urinary tract infections. So when we put children on antibiotics, we anticipate that it's going to be E. coli. So we usually like to use our cephalosporins, which is a class of antibiotics that we use for urinary tract infection. See your doctor so that you can be on the right dose for the urinary tract infection. Once the culture comes, some children might grow Klebsiella or Pseudomonas, which is unusual. If a child has an abnormal urinary tract system, then they could grow all those unusual bacteria. But if it's just a straightforward urinary tract infection, most children will grow E. coli. And once they take the antibiotics, the duration can vary from 5 to 7 days, depending on whether it's a kidney infection up at the back causing back pain, or which is like right here, we call it flank pain. Or if it's just a simple bladder infection, it's 5 days of antibiotics 3 times a day. If it's a kidney infection, then it's 7 days of antibiotics 3 times a day. And usually we use this class of antibiotics called cephalosporins. Now, when boys have urinary tract infections, this is quite rare. So we usually...
Why is that?
Because a boy's urinary tract is like, you have the penile system. It's really away from the anal area where poop is. Okay. So when you start seeing, especially little babies, a lot of boys, when they're in their neonatal period and they have a high fever, they can end up having a urinary tract infection, and that is supposed to be associated with uncircumcised boys. They say when you circumcise a boy, the risk of urinary tract infection, especially as a baby, is very low. I've seen boys who are circumcised. When I was in New York, we would have a few babies that were circumcised and they still got urinary tract infections. And that's because when the baby poops, the stool can migrate to the pee area and go through the penis into the bladder and cause bladder or kidney infection. Some of these babies, when they have infections, it can go through the blood into the kidneys and infect the urinary tract. When a boy has a urinary tract infection, it's unusual. So when a child, especially if they're boys and they've had urinary tract infection, or if they're girls and they've had multiple urinary tract infections, we like to do 2 tests. We do a renal ultrasound scan, especially like a month after the infection, and we also do a voiding cystourethrogram. The reason we do those 2 tests is to make sure that the children do not have reflux, where the urine is leaving the bladder and going up into the kidneys. Yes, that's called retrograde flow of urine. Some children, when they have, it's called vesico-ureteral reflux. That's basically the bladder, is the valves that are supposed to push the urine down are not working. So there's reflux where the urine is going back up where it's not supposed to. That increases the risk for infections in the kidney and in the bladder. So when children have that, then they need to be on antibiotics prophylactically so that they don't end up having kidney infection. Because if you have too many kidney infections, your kidneys can get scarred, and then that increases the risk of you having kidney failure at an early age and needing dialysis.
Wow. That's so complicated.
So it's just one of those things where if your child has a high fever and you are seeing your doctor, ask them to do a urine test, because we want to make sure that we don't have children that are having urinary tract infection and is not being checked or treated. You see a lot of people are on dialysis. Sometimes you ask, what caused dialysis? It could be just self-treatment of medication. It could be something like hypertension. Most people on dialysis, they would have had a chronic history of hypertension. But in children, if they're having urinary tract infections that are not treated, that increases the risk of them being on dialysis as adults, because they might end up having scarred kidneys. That's another whole topic.
True.
You didn't know this, right? Yeah, so that's the reason why we're giving all this information out. Actually, nephrology is actually one of the areas that I loved. I actually used to write questions for
medical students.
For medical students in residents when I was the chief resident in Loma Linda. And I volunteered to be on the one of the bodies for pediatric boards, writing questions in nephrology, yeah. But anyway, the bottom line is we need to take symptoms of urinary tract infections seriously. So what are the symptoms of UTIs? The child would say, oh, it hurts when I pee.
Do they itch as
or
well?
They might be extremely, they'll scream and cry when they want to pee. And when it's so painful,
They have painful urination.
They have painful urination, and then they don't want to use the potty, or they don't want to pee because it hurts so much. And when they pee, they might pee just a little bit because the bladder is irritated from the infection. So they might pee and it's like a few drops, and they are in the bathroom every 5 minutes trying to pee because the bladder just has that, gives them the sense of, so they have frequency, they have painful urination, and then they can have blood in the urine. They pee and the urine.
They don't itch as well.
No, itching is not a common. They hurt, and then they could also have what we call bladder spasms. They might just have discomfort in the bladder and urgency. They just always feel like peeing, and when they pee, they just die with dribbling. They just pee a few drops. So when children are having those kind of symptoms, please bring them in to see the pediatrician, because it's extremely uncomfortable. Sometimes I tell people it's like when you have a bladder infection, it's almost like peeing out your bladder, and you feel like your whole body wants to come out, and there's nothing there. So once we treat with the correct antibiotics, if the culture comes back positive, we always recommend that pediatricians and patients should make sure that the urine gets rechecked. Because once the urine gets rechecked and it's clean, then you know that the child is healed and the urinary tract infection is gone. If children are growing abnormal organisms in their urine cultures, like the Pseudomonas or Klebsiella, they definitely need to have a voiding cystourethrogram, which makes sure that the urine is flowing from the kidneys down to the bladder and out of the body, and there's no retrograde or backward flow of the urine. because those are the risks that children with this vesicular urethra, there's 4 types. Yeah, stage 1, stage 2, stage 3, stage 4. Some children might have reflux so bad where all the urine is going back up and they might need to have surgery. So those children should be followed by the urologist. They should also be on antibiotics prophylactically, depending on the grade. If you're a grade 1 or 2 reflux, vesicular urethral reflux, where the urine is going back up, but it's not going all the way to the kidneys, it's just going like less than halfway up. That's how you grade it. If it's going all the way up, it's a 4, a grade 4. If it's going 3/4 up, it's a 3. If it's going halfway up or less, it's a 2. And if it's going just a little bit up from the bladder to the kidneys, then it's a grade 1. So if it's a very mild one, it tends to, as children get older, it tends to correct itself and go away. Grade 1 or 2. But if it's a grade 3 or 4, those children are monitored very closely for improving symptoms. And if they don't have any improvement, then they'll need to have surgery. So urinary tract infections, as simple as they might be and as uncomplicated as they might be, sometimes they need to be checked further, especially if it's in a boy or if a child has had multiple urinary tract infections. Once they're having like their 3rd urinary tract infection and they're girls, 4th, 5th, and they're growing abnormal bacteria, they need to see a urologist, they need to see their pediatrician, they need to be checked properly with a renal ultrasound and voiding cystourethrogram. And the other thing is simple cleaning.
Yeah.
When girls clean, they should clean from front to back.
Yes.
If they clean from back to front, please make sure you edit it. Then it's a problem. And that's when they put poop in the pee area.
Oh.
And we always recommend when children have had urinary tract infections to use wipes, like the baby wipes, to clean when they use the potty. So that way everywhere is nice and clean and they don't have any risk for urinary tract infections. And that's really urinary tract infection in a nutshell.
Yeah, so thank you very much. I hope you've learned 1 or 2. So until next time, and please don't forget to subscribe. That is very important so you can keep updated with pertinent pediatric information in our world today. So take care.
Bye.